Awesome. Welcome, Phil. My name is Sloka Iyengar. I'm the Director of Marketing and Communication at Statistics Without Borders. Today, we are talking to Phil, um, whose company, whose organization, Bridge to Health, did a project with SWB. And what we want to do is really highlight the project, the work that Phil's organization is doing. So, welcome, Phil. I'm really happy to have you here and to just talk about the work that we've been doing together.
Yeah, excited to be here.
Thank you. So, could you tell us a little bit about how did you come across SWB? What was your, yeah, how did you find us?
Yeah, so it kind of started with we had some gaps in our program that we were developing that we needed some external help with. That included like some translation stuff, some statistic stuff. So we kind of looking around forums and seeing, what kind of services were available. Like there were some freelance services, and then I stumbled across a forum post that discussed your organization. And they mentioned them, and they said, "Hey, this is a really cool org that is working on a lot of really interesting stuff recently, and they're helping out a lot of nonprofits. Maybe you should look into them." And so I did, and I came across your website, and I just sent an email asking, "Hey, is this something you guys would be interested in working on and helping out with?" And then I went through the application process, and yeah, it worked out really well.
That is amazing. Could you tell us a little bit about your organization, Bridge to Health, and what are some of the things that the organization does and what you do?
Yeah, so Bridge to Health, we've got two main kind of components. We've got a component in the US, we've got a component in Canada. In the US, we're a registered 501(c)(3). In Canada, we are a registered charity. And we do a lot of kind of international health outreach, usually in the context of like continuing medical education for practitioners. For an example, we'll have Canadian healthcare workers go out to excuse me, sorry. We'll have Canadian healthcare workers go out to lower middle income countries and provide education programs on like ultrasound use, and with devices that we donate to partner hospitals in on like regional clinics or regional sites like that. And we've tried to scale that up a little bit right now. We're working on a program in Yemen where we're doing a similar thing, but we're doing the whole thing virtually, which is kind of new for us. And that's what your organization was helping us out with, kind of developing a nice kind of analysis plan for describing our outcomes from that project. We also have partnered with the Amazon Medical Project, and we run a clinic in off the Amazonian River in Peru, which is pretty cool. And we've got some more local initiatives in the US and Canada where we're working on implementing training programs for community health workers, and kind of linking them up with virtual practitioners so that people can have everything for their care at one site. It's all about kind of streamlining, I would say, the process of healthcare and making sure it's more accessible and available for people. That's a real kind of prerogative with most of the work we do.
That is amazing. Wow. And that is so cool. I love listening, like getting snapshots of the actual projects that you're working on. Um, could you tell us a little bit more about the project that like the collaboration between SWB and Bridge to Health? Um, and how did the project advance your organization's goals?
Mhm. Yeah, so kind of the biggest issue was that we didn't actually have a very specific analysis plan in place for our data set. We knew what kind of data we would have available to collect. We just didn't really know how we would kind of extract it all and analyze it. And so the issue with working in any lower middle income country, or I guess a conflict zone, if we're talking about Yemen specifically, is that the accessibility to data is like very sparse. We don't have things like electronic medical records. We don't have things. There's generally a lack of consistency in just even the handwritten medical records. So because we've got these big gaps in data, we have to be very creative with what data we have available, what data we're going to use, and how we're going to try to extract that data to tell the story of the program. And so SWB came in and they really helped us develop a strategy for being able to use that data in a way that we can use to really, exemplify where our program's succeeding, where it's having, struggles, and how we can highlight all those things through the limited data we have.
That is amazing. Thank you so much for sharing. And could you tell a little bit about, the process of working? You talked about how you found us, you filled out the form, somebody reached out to you. How was the process of doing the project itself? And do any things or does anything stand out in that arena?
Yeah, I mean, personally, for me, one thing that really helps a project's momentum is having like weekly team meetings and kind of getting things off the ground. And Christian and Janet were great with that. They were super on board to get those weekly team meetings rolling. And so every week we would meet at the beginning of the week. We'd have action items for the week. We'd get those things done, and then we reconvene the next week, reevaluate where we were at, and then continue on. It was just fantastic. It was so smooth, and very professional and very easy to get things done. And even if there were hiccups, we just have a shorter meeting and we kind of regroup next week. So very easy to work with the organization and very easy to get things done.
Thank you so much. That is amazing. Um, and is there anything else you would like to share? The people that will be listening to this are, are part of SWB. So, with an interest in statistics, but also with an interest in really giving back. Is there anything else you would like to share about your organization's work that people can probably get involved in, or anything else in general?
Yeah, I mean, we're always looking for, more partnerships. I think it'd be awesome if, we could work together more between the two orgs in the future, kind of work on more projects together in the future. I'm really happy with how everything worked out with SWB and our organization. We're always, looking also for our own volunteers and interns with Bridge to Health as well, a similar thing, if anyone wants to come join on and help out, we always have some work to do. And there's also, eventually the potential for a paid position, down the road with our organization, kind of thing. But that's all dependent on funding, which I'm sure you're familiar with, kind of thing. But yeah, no, just a lovely experience all over working with SWB, and I hope we can continue to work together in the future.
Oh my goodness. Thank you so much, Phil. Thanks for being with us. Thanks for sharing your experiences.
Of course.